There are near-record low levels of vaccine-preventable childhood diseases in the United States. But that doesn't mean these diseases have completely disappeared. That's why it's important that children, especially infants and young children, receive their recommended immunizations on time. The ages when vaccines are administered are not chosen at random. They're given at specific ages so children can have the earliest and best protection from disease. Some are given in a single dose, and others in 2 or 3 doses a few months apart. The children in your program should have all the immunizations that correspond with their age. The New York State Department of Health updates its list of required vaccines regularly. It's available on their website at health.ny.gov or from your county health department. The number of vaccinations needed is age-dependent and is based on the American Committee of Immunization Practice recommendations. This schedule is also easily found on the web. There are 3 recommended immunization schedules. Be sure to use the correct chart for the age and circumstances for the children in your care. The first is for children birth to 6 years old who are on schedule with their immunizations. The second chart is for children 7 to 18 years old who are on schedule. The third chart is the catch-up immunization schedule. It's used for children 4 months to 18 years who start immunizations late or who are more than 1 month behind in their immunizations. The table on the catch-up schedule gives the minimum age for the first dose and the minimum intervals between doses. It's important to note that a vaccination series does not need to be restarted regardless of the time that has elapsed between doses. If a child in your care has missed any immunizations, consult the catch-up schedule and ask the parent or guardian to check with their healthcare provider about getting back on track. Children who receive regular medical care are much more likely to get their vaccines on time. However, even when children do receive regular medical care, other circumstances may come into play. For example, if a child is ill, the healthcare provider may decide to postpone an immunization until the child has recovered. In these cases, ask the parent or guardian for written documentation from the healthcare provider that the child is on the catch-up schedule. Immunizations are powerful tools in the fight to prevent illness and disease. They're so important that OCFS regulations state a child cannot be admitted into the program unless his or her immunizations are up to date according to the New York State Department of Health requirements, or until the parent or guardian has provided them with specific appointment dates to get the required immunizations. When programs know the recommended childhood immunization schedules and maintain accurate records for each child's immunization, they play a key role in keeping children safe and healthy.